the audience almost wants to know. But quick overview: we've both been homeless. We've both, I'm sure James, you won't mind me saying, but visitors to the criminal justice area. Yeah, we've both been inside. We come from, I think, probably different backgrounds to a degree. So obviously his experiences are nothing like mine. I've had some really nasty experiences in hospital. You know, in the place where you think when you go in, I'm going to be safe there. At least I'm going to be safe in here, and it often isn't the case. I've recanted this so many times. It's almost tattooed across my forehead. But I took an overdose many years ago, and whilst I was in there, I was in a hospital. They gave me a stomach pump. But I came round, and I remember lying there on the gurney thinking, I'm glad I didn't die. I'm glad I didn't die. And there was two nurses stood at the foot of this gurney waiting to take me upstairs. And one of them, I think she must have thought I was asleep. She turned to a friend, a colleague, and looked at me and said, you know, I don't see why we should waste NHS money on scum like that. Why didn't we just let him die? He wanted to die. Wouldn't that be the best use of our services? We should have just wheeled him outside and let him go. Now, you don't expect to get that sort of an experience from a caregiver. Was it nurses are the caring profession? Well, unfortunately, not all of them are. And I'd hate to think that there's any on this call. So for a moment, I'll pass over to Jamesy, because otherwise I can talk for 2 hours.
Jeff will just talk forever, yeah. It's I mean, just going off the back of what Jeff was saying, and it's like when you, I've sort of said this same sort of speech to people lately, and it's when you're homeless or when you're down on your luck, you're at your most vulnerable. You know, you're most vulnerable that you're probably ever going to be in your life, and nobody chooses to be homeless. It's usually because, I mean, you may have had to flee another country because of war, leave everything behind, or you may have just had so many traumatic experiences in your life. Like, I know, again, both me and Jeff have had, you know, and my own sort of started with abuse as a child, and then self-medicating and becoming a heavy drug user for about 30 years. And it's just a spiral down. And I ended up in prison, and then I ended up in a hostel. And you access healthcare, and you're very, very vulnerable, you know. And if you're street homeless, it's even more so. You may have to walk miles to go to your hospital or your doctors. You know, you may not have eaten properly for a couple of days. You probably won't have slept very well the night before. You know, so you're scared. Everybody knows what it's like being sort of, I don't know about anybody else, but I get hangry if I'm sort of really hungry. I get angry, and your blood sugar drops, and, you know, you might not have been able to bath or wash. And then you go into this establishment that's lovely and bright and clean, and there's all these sort of sterile people, and you feel dirty, you feel grimy, you feel horrible. It may have been such a big step for you to actually step over that threshold into that place, and you just need, what you need straight away is just wraparound care. You need somebody to almost come in and just take you in and say, well, look, don't worry about how you look, don't worry about how we'll help you. And, you know, people go in, they've got issues around drugs and alcohol, and won't get seen because they've used drugs or alcohol. Well, if you're a heavy drug user or a heavy alcohol user, of course you're going to go in under the influence, because that's your whole life. You've had a drink or you've had drugs. You know, are people saying that they can't get any health care because they've got a drug addiction or an alcohol addiction? They might have mental health issues and not know how to sort of relate to people. They may have been on the street so long they've become sort of emotionally isolated, and they just don't know how to interact properly anymore. And you've got to take all this into account when a homeless person walks through your door, and sort of see past that, and see past all these sort of in-your-face issues, like the smell. You know, of course they're going to smell if you haven't bathed for weeks. You know, the smell, the way they look, the way they're presenting. You've got to realise that behind that, there's a whole list of problems that have got them at that point.
I actually went in once. I mean, obviously I have been street homeless as well as being in hostels, but I was staying in a hostel once, and I developed stomach issues. I don't know what. I had a kidney stone, it turned out, but I had to go to the hospital. So I was fine in the morning. I'd got up, got dressed, had a shower, and within 20 minutes it was in agony, and I got taken to the hospital. And I got to the window, and she said, "Address," was the first thing she said. "Address." Like, right, okay. So I told her where I was staying. It's a hostel, that, isn't it? Yeah. And she turned to somebody next to her and said something which I didn't get. And the next thing you know, a nurse came out from behind. A nurse, not a clerical officer. A nurse came out with a can of air freshener and sprayed me head to toe. Literally walked around me. Now that was bad enough, but then there was like 3 lines of people. So there was a line I was in. There was 2 other lines. Everybody then moves away. Oh, he stinks. He smells. He smells. I didn't. I'd been in the shower 20 minutes earlier. But because I'd been in a hostel and they knew it was a hostel, they assumed that I smelled. And it's not even just that. I mean, that's bad enough anyway. But there was a little old lady in front of me. Because I remember thinking, oh, look, Miss Marple, this little old lady, she almost had a knitting with her. And when she went to the window, it was, "Hello, dear, what can I do for you?" And then when I went, it was, "Address." Whoa, straight away, you're always on your guard. I've got a hospital appointment on the 1st of June, and I'm not homeless anymore. And it still terrifies me, the thought of going in there, because this learned behavior, this learned threat almost that's there, it still bothers me. It still bothers me every single time I go in. If you're street homeless and you're going into a hospital, it is terrifying. You don't want to be in there, but often you've got to go in. I've been outside a hospital when I knew I had to go in, and got to the point where I think, maybe it's just better if I just give up and go away and die in a corner somewhere, because I don't want to go in there. It's terrifying. It really is.
It's even the sort of point where you sort of got to think about the other thing. It's sort of like I was saying about the sort of maybe having to walk a long way to get there, not having a telephone, not having access to the internet and that. When you go into a doctor's or you go into a hospital, you seem to have a set, limited amount of time, and they'll see you for this. Whereas, if you're homeless, if you're street homeless, like Jeff was saying, it took all his willpower to step over the threshold once to get in the hospital. Once you've got somebody in there who's homeless, keep them there and sort out what, because you're going to have more than one thing wrong with them, and these needs aren't being met, and that's why people who live on the street, the men who live on the street, usually die by around the age of 45, and that's a horrendous statistic, that. And it's because they're not getting, it's obviously, there's other reasons, some of them might be drug users, they may overdose, some of them may die of sort of alcohol related or violent things, but look, most of it's healthcare and the lack of healthcare. So when you've got the opportunity to work with somebody who's homeless, make sure they get like the full MOT. And I know it's hard, and we're aware of the hard job that doctors and nurses and frontline staff have. Nobody's saying it's easy, and it's just, we know people are pressed for time and money's short, and people have got sort of bosses breathing down their necks and everything, but it's just kindness. It's just this bit of kindness, and you'll probably be saving yourself time and money in the long run.
You'll also get a better reaction from the next person that walks in, because I know when I was street homeless, in Leeds for a while, and I remember one of the guys had to go to the hospital, and when he come out, everybody was literally gathered around him like, "So what was it like?" It was like, "Bloody awful. You don't want to go there. If any time you go to hospital, go to a different one, because it was awful." And they'll talk to each other. Now the problem you've got then is everybody else that's out there then mistrusts the hospital. If you get somebody who goes in there and they're treated really well, and they're given the care that they require, and they're not treated like a social pariah, then he'll go out and tell everybody else. It will make it easier for the other ones to come in and actually present themselves at the hospital. It's that almost that unknown factor. Am I going to get treated like dirt? Am I going to get treated like a piece on the bottom of my shoe? I felt that myself. I always, when I was street homeless, felt like dirt. I felt awful. and I would go in on places like the hospital and apologise for the way I looked or the way I was dressed, or because the fact I was dirty. I didn't have any choice. I didn't have any control over it at that point. And a lot of nurses would be like, nah, don't worry about it. Come on, you can come in the bathroom. We'll get you cleaned up. See if we can get you some clean clothes. And then you would get the other side of the coin to be like, well, you know, you shouldn't have come in here. You should have gone somewhere else. So we can give you the address of somewhere else you can go. I mean, one time, sorry, just one time I'll actually leave, and I'd had my care, so opposed as it was, my treatment, and I collapsed in the doorway. Like, I hadn't eaten for days. And this nurse came over and helped me up and leaned me against the wall. She said, "You okay?" I said, "Yeah." I said, "I'm just a bit worried." I said, "I've been discharged." I said, "But I haven't eaten for a couple of days, and I haven't got anywhere to live or anything." She said, "Oh, there's a bus shelter across the road. You can keep in there." They all do. And just turned away and walked away. Like, not exactly the vision of care I was expecting, you know?
No, and it's like, I mean, the pandemic showed us one thing. It's that nobody's safe from homelessness these days. And a lot of people who were secure in the properties aren't, and a lot of people who aren't are finding it hard to keep up with the rent. And you know, there's a lot more homeless people now, and you've got to look at people and think, well, therefore, you know, the grace of God, or therefore the sort of, if a life went down another path, that could be me, or could be my sister, my brother, or my son, or my daughter, and all people, you know, just people, and just at the worst, just people who are at their most vulnerable and most needy, and they're the people that need to be helped the most.
I'll be honest, if you're straight homeless, you don't want to go in hospital at all, ever. You don't want to go in hospital because you're frightened that you'll never come out of it, that you'll die in there, that whatever's wrong with you will finish you off, type of thing. So if you are so desperate that you are going to go in there, you don't want to get ill treated or bad treated or treated like dirt, because you'll never go in again. It's like what James was saying there, that empathy thing. If you look at everybody that you see as, that could be me or my auntie or uncle or brother or sister. If you imagine one of your parents, say you go home to visit your parents, and your parents says, "I went to hospital today and I was treated like dirt." Well, you'd be up in arms. You'd be straight down to the hospital to complain. But there's nobody to complain for street homeless. They're there on their own. We're lucky these days with some hospitals, obviously with the likes of Pathways, because Pathways have teams, the Pathway team in the hospital, and they work specifically with people who come in off the street who are homeless or itinerants or whatever. But the Pathway teams are few and far beyond. There's not very many of them about. Ideally, we could do with one in every single hospital, or at least a decent discharge system.
Yeah, I was just going to say discharge. I
spoke to a discharge nurse at Newcastle Hospital recently, and I said, "So what do you do if they're street homeless?" "Oh, we send them." This was all through the pandemic. "We send them to HAC, which is the local housing advice centre." And it happened all the way through the pandemic. I said, "Can you tell me roughly how many you sent?" "No, we're not allowed to discuss figures." She said, "But quite a lot, right? You sent them to HAC, yeah." So did you know it was closed? Well, there'll have been somebody there. "No, it was shut the whole of the time." "Well, they're gone and they're no longer our concern. So you've just sent them somewhere. You didn't check if it was open. And once they're gone, it doesn't matter because they weren't your concern anymore."
We've heard of people being we've done some research recently, and a few bits of research around people's sort of healthcare during the pandemic, or with transfer from prisons into the community. And the amount of sort of stories that come out of people who have been discharged from hospital to an inappropriate environment, you know, and it's not, we know it's not, housing isn't the sort of the remit of hospitals, but surely the aftercare of people who've been in your care must be like, there's people that have been admitted to hospital maybe because they've got ulcers on their legs from injecting drugs, and then they're sort of discharged to a hostel that's well known for the heavy drug use, you know, so they just go straight back and get back on the drugs. They may have been in the hospital for months, got clean, but they're just put back in the situation again. Or like Jeff was saying, there was a bus stop across the street, you know, just being released into the street, and it's not good enough. It's just not good enough, and we don't think it's not like your job only. It's you know, there's more people that need to be involved in the hospitals, but you just need to be taking it on board as well.
I think it's a job for everybody, to be honest. We all, as a group of health professionals, non-health professionals, which is why we do things like this. I mean, some of the things I talk about in my past are upsetting. They're upsetting to me to even think about it, and I relive it and relive it and relive it. And somebody asked me recently, well, somebody stated something recently, like, well, why do you do it? Why do you keep repeating it if it's harmful to you, if it's upsetting? Because there will never be decent change if we don't. If you tell everybody, oh, it's all lovely, oh, it's fantastic. We recently, well, not that recently, spoke to the head nurse of England. I can never think of a name. What's that? The chief nurse officer of England. I can't think of a name.
Ruth May.
Ruth May, yeah. And she'd asked for like bad stories, and I told her the one about this nurse when I'd taken the overdose. She said, I want a name. I'll sack her now. So, well, you can't have a name because I don't know a name. She said, well, if I ever hear of anything like that again, I want to know. She'd cuts the gun because they're bringing us into disrepute. They're making us look as if we don't care, and we do. But that should never have happened for somebody in the caring profession. Yeah, she might have had a bad day. She might have had all sorts of crap going on in her private life. But I've worked in the health service myself, and you've got to leave that part of it at home. You know, if there's crap going on at home, leave it at home, come to work, and be that caregiver, be that person who cares, not somebody who she really didn't care at all. And I'd like to think in the future, everybody's going to be the better ones and not the bad ones.
And we sort of, we're one of the like I like telling people in every meeting I go into that we're one of the 10 strongest economies in the world. You know, we should be able to afford to look after. Well, we can afford to look after every member of our society. So why aren't we doing this? You know, why aren't we doing this? And everybody's got to speak up about it. And it's because people. It's few and far between that people that actually want to listen to people who are homeless because they're the poorest, they haven't got any voice, so you know, so their needs just get glossed over.
When I first started doing
in the background,
when I first started doing this sort of stuff, Jamesy, I was in a meeting with NHS England and Sam from Pathways, Sam Downey-Smith. And there was loads and loads of health professionals and little old me. And I said something about, yeah, but I'm only an EBA. I'm only me. And she messaged me later afterwards. She said, if you ever say I'm only again, I'm going to come over there and beat you senseless pretty much. You know, you're not only, you're the expert. I'd rather have been an expert rock climber or an expert at anything other than homelessness. But it is what it is. And it's, if we can say anything at all that will change the way you look. I mean, I think the time I was in hospital when I'd taken that overdose, I'm laying in the bed. I remember being on the ward and there's all these drips. I think I had about 3 drips going into me. And nurse after nurse went past, and every time somebody went back, can you tell me what this is? At least 3 told me it had nothing to do with me. But it's their job to sort out the care, and it's nothing to do with, well, it had nothing to do with me, but it was going into my body, whatever it was. I think it had something to do with me. And eventually there was 2 doctors that I found out I think they were 3rd-year medical students. 2 of them were walking past, and I just, oh, pal, come here. And this guy came through, and his mate's like, oh, come on, we haven't got time. He's like, no, we make time. What's going on? And he sat in the bed, and he explained what every single drip was. Got my chart, read the chart, told me exactly what was going on. And for the first time, I would say, in up to that point, maybe 10 years of going into hospitals, it was the first time I got any humanity. It was the first person that really cared. And this other doctor that was with him was shouting at him, we're going to be late, you're going to be late. It's like, I don't care. You go, I'll be as long as it takes. And he sat there for about 35 minutes. He was really, really good. But I'd like to think everybody who works in health services like that. I know you don't all have the time. I know you're confined to the time limits. I know that. But there must be a way we can change it to make it so you can give the time, or at least have somebody there who can give the time.
And this isn't sort of like us having a witch hunt at you know, because we know we're just highlighting the bad examples because that's what they're so why we're here. We've all had really good experiences, and there's doctors and nurses out there who are amazing at the jobs, and there's front staff, and there's reception staff and that who are brilliant. I mean, my doctor's surgery is fantastic when I go to. So we know it's not everybody, but it's sort of when you see the good and you see the bad and the sort of the difference between the two, and it's like, why is the bad allowed to continue?
It's the bad you remember as well. It's the bad that sticks in your mind the most.
Of course, yeah.
It's that, like I say, this thing about I've got a hospital appointment coming up, and it terrifies me. It shouldn't. I haven't been homeless for 5-6 years coming up, but it still terrifies me just the thought of going in there. And unless I've got somebody to go in with me, I probably won't even go in. I'm only going in to give blood, for them to take some blood tests, but I won't go in if I have to go on my own. Just won't go.
I was gonna ask, is there any sort of tips or advice that you would give the students, you know, when they're talking to people who come into hospital who are experiencing homelessness, in terms of, you know, showing that they care, showing that they want to help?
We did some research recently in Newcastle, and this thing happened to James, and it happened to me when it was during COVID. It was towards the back end, and the guys were coming in off the street to talk to us for the research, and we were told, you've got masks, we've got gel, don't shake anybody's hand because it's COVID. And it was like, wash my hand afterwards, no big deal. And I know it happened to him, and it happened to me, where somebody put their hand out and then realised they couldn't, and I shook this guy's hand. And as I say, I know Jamesy did it. Shook this guy's hand, and he was just afterwards. We had the chat, and we went through. We got all the information we wanted, and he leaned in really close, and he said, "You know, it's the first time in 3 years anybody's touched me.
Yeah,
and I've never had anybody shake my hand before, and you didn't look at your hand to see if it was dirty, or you've got to look past the dirt. You've got to look past the smell, whatever." I mean, hell's bells. I worked in podiatry for 6 years. I know what smells are like. A little bit of Vicks inside your nose, be fine.
And it is bad sometimes. I mean, you know, if somebody's been living in street homeless, this quite often the smell very mildewy, very, you know, it's an overpowering experience, and it is. And there was a guy, one of the ones I shook hands with, and his nails were like about an inch long, and they were black, and and it's not because he wanted to be like, he was apologizing about the way he looked and the way he smelled, you know, and he was like, oh, you all look so nice, and he was like, I'm sorry, like, you know, I'm sorry I look like this, and I was like, you never need to apologize ever to me about the way
I almost felt guilty that he felt like that. So if you can put them at their ease, and I think it's all this stuff as well as like eye contact. I've had doctors who were doing this on their screen and talking to you.
Yeah.
You can look at them and actually look as if you're interested in what they've got to say. You're going to get a better reaction from them. But if you're going to, like if my patient was in front of me and I was sitting there doing this on the computer and still talking to them, well, yes, you're having a conversation, but it's not the same. It gives the idea that you don't really care.
And look past the symptom. And I know it's hard because you're a doctor and you make like a diagnosis on finding what symptoms a person's got, but there's always a story behind the symptoms. And, you know, of course, if somebody's had a really bad upbringing or a really bad childhood, of course they're going to be experiencing certain mental health issues in later life. If somebody's living on the street it's the middle of winter, of course they're going to have like physical problems with the backs and the arms and the sort of, you know, just remember the story behind the symptoms, the person, and just try to get the bottom of that and try and see the person.
I think always at the end of the day, I mean, I think it's almost overused, but you've got to show empathy. Yeah, I always say it. If you can think of the person that you're looking at is you. How would you want to be treated? Would you want somebody to look at you? Would you want somebody to look as if they were listening? Yeah, you would. You wouldn't want them to turn away and just like be doing whatever while they were talking to you, because it's not nice. You don't have to stare into their eyes and hold their hand all the way through it, but just show that you're interested in what they're saying to you, because it will have taken a lot for some people to actually get to that point, and it would be really hard for them to share their story and tell you what's going on. So if they think that you're interested, then you're more likely to get the full picture. Did you notice there, Chris? I mean, me and him can talk all night, really.
Yeah, we've actually got.
But you stopped very suddenly.
You got exactly half an hour there. I'm quite proud of us.
That's very good. Very good. Does anybody have any questions from the students? If you'd perhaps like to just type them into the chat, and then we can ask, or just quickly turn your mic on and ask. We've got time for a couple of questions. We've got 5 minutes. People want to do that.
I just had a quick question. Firstly, thank you both so much for talking. I think it was really eye-opening and quite shocking to hear how you've been treated. And I do hope that things change going forward. And I hope things like this can help change treatment in the future. But I wanted to ask, when you're seeing someone who's sleeping rough or in kind of in a vulnerable housing situation for the first time, do you have any tips for how you can kind of put them at ease and reassure them that, you're there for them? Just
see that.
Yeah, exactly.
Say, just say I'm here to help you. We're going to try and get through this. We're going to try and sort out what's wrong. Just be honest with them and give them the time, and just be aware that they might not be in the best mood. They might be a bit sort of erratic, and they might be a bit all over the place. And it's because they're homeless, and they may have just become homeless. So just be they're looking at you for a sort of a bit like a rock or a bit like an anchor. The doctor's somebody who's going to be there, and they're going to be sort of help them, and there's something wrong with them, and the doctor's going to tell them what's wrong with them, and they're going to help them. And what we all hate is going to the doctor's surgery, and the doctor going, "What can I do for you?" And when you tell them to go, so how do you think I can help you? Go, well, I don't people know, you're the doctor. You just need somebody strong, a bit decisive, and honest, I would say.
Thank you. That's very good advice. Any other questions from anybody else, either in the chat or do you want to just quickly ask?
Yeah, thanks for sharing your experiences, guys. It was and great to see where you've come from, and now that you're being able to use your experience to help lots of others. I mean, we heard about some of the sort of, I guess, slightly negative experiences you had in healthcare. Can you remember any sort of positive ones with either sort of clinicians, either nurses or doctors, who sort of help rebuild your trust in the healthcare system?
I remember a doctor in Newcastle. Funnily enough, I mean, I live just outside it now, but it was years and years ago. When I was straight homeless, I didn't like to stay in one place at any time, so I'd hitch and go all over the place. And I'd been in Newcastle 2 or 3 times, but I'd gone into one of the hospitals. I don't know which one it was. I'd had a fall, and I remember I was cut. I had quite a good cut above my eye, and I walked in, and I must have looked a state. I mean, I had a rucksack, and I was probably very scruffy, very dirty, and the reception staff were trying to get me to stand outside, and the eventually got to the reception, and the receptionist told me I had to wait in the corner until the normal people had been seen. So I had to go and stand in the corner, literally across the other side, and a couple of nurses just walked past and ignored me. And then a doctor came through with he had a couple of nurses with him, but he came through and he obviously spotted me there and went over to reception. And I had to say something like, well, I've told him he has to wait over there. And he came over, he's come with me. come with me. I was like, where we going? I haven't signed in reception yet. They haven't listened to what's going on. He said, I don't care. I'm not listening to them. He took me down to A&E and had me head x-rayed, and he got one of the other nurses to clean it up. And then he says, we can get you some clothes as well if you need any clean clothes. He said, I'm not saying you do. You don't. He said, we have a laundry here. He said, we can get all your clothes laundered. He went above and beyond what I ever expected anybody to do. So I got the treatment I needed. He got me some clean clothes. He had the clothes that I had with me. Everything in my bag was dirty. He had all that washed. And he made a phone call and he got me a bed for the night. But it was a very rare occasion. So yeah, there is some good out there, definitely.
Yeah, thank you.
Then we get like sort of people like yourselves and other doctors we work with all the time coming into group to sessions like this and listening to us and working with us and trying to make the service better. So you're all sort of doing that little bit.
Yeah, we're classed as experts by experience, ABEs, the voice of lived experience. Well, it didn't matter 10 years ago because nobody gave a monkey's what we said. They just didn't listen. It's good to hear, finally that people do listen and want to know. I mean, all sorts of things. NHS England, I was in a meeting earlier on with NHS England, and they really want to listen to what we have to say to try to change things for the better.
That's great. I think that's a very positive point to end on, that hopefully things are moving in a different direction now. And as you say, the students listening now are sort of part of that for the future too. So I think that bodes well.
Certainly better to get them as students.
Yeah, absolutely. Yeah. Absolutely. Well, some of them are quite senior students now, so they'll be doctors very soon. But yeah, I think hopefully that will send a cohort of people through the system that might be looking for change. So thank you ever so much, Jeff and Jamesy. It's really kind of you to give up your time this evening to talk to us. Very much appreciated, and you've obviously got through to a lot of the students. So that's really really good. So thank you.
Our emails on the chat if anyone wants to contact us and
brilliant.
Have the ears bent anymore. We're willing to just drop us a line.
Fantastic. Thanks ever so much. I'm sure you'll be getting some mail. Fantastic. Okay, thank you. And
thank you for having us.
And you're very, very welcome. We'll see you soon.
Okay, bye-bye.
Bye-bye. Jeff. Okay, so we'll move on. So we're going to have the students from BSMS, I can see are now joining us, which is fantastic, to talk about the work of their Homelessness and Medicine Society. Yeah, are you happy to introduce yourselves?
Yeah. Sorry, everyone. I'm just trying to get my computer to work. This is not my strong point.
Okay, so hi, everyone. We are from HOMED, Brighton and Sussex Medical School Homeless Medicine Student Society. And we're just going to give you a brief overview of what we did, how we manage our society, what we did in the past, what are we doing now, and just some lessons we learned along the way, so you can use them to maybe start your own society and hopefully not make the mistakes we did. So my name is Inessa, and I am the current president of HOMED, and I am in year 1.
I'm Ellie, and I was the president of HOMED from 2018 to 2019.
And hi, I'm Janani, and I was the vice president with Holly as president 2019-2020. So we had the COVID year experience. So just before we start, we're just going to go through a few demographic points of why homelessness is so prevalent in Brighton, and a lot of the reasons Jeff and Jamesy have already spoken about, and it's so complex and multifactorial, and everyone's situations are so different. But some statistics from Brighton. Brighton has a very large homeless population, with 1 in 78 people, according to a 2019 shelter report, having experienced homelessness. And it's the 4th highest has the 4th highest homeless population outside of London. And according to a Brighton and Hove health audit, 50% of people who were homeless were experiencing disabilities, and many people had experienced mental health issues, substance misuse issues, and a lot of it was because their health needs weren't being met. If you could go on to the next slide, please, Ellie. So just some sort of more like statistical reasons of why homelessness is so prevalent in Brighton. Again, it's so multifactorial, but specifically to Brighton, housing is crazy expensive. On average, it's £1,000 per calendar month for a single bed, and shared beds are £500 to £800 per calendar month, which is crazy. Social housing has been cut all over the country, and so there's more people renting privately than using social housing, and there's less supportive systems that are much harder to navigate, and housing quality in Brighton's pretty poor as well in terms of social housing. And then similar to housing, mental health services have been cut quite dramatically over the last few years with our government, and this has meant that more people have shown with more people who are homeless have developed more complex needs because their health needs aren't being met by services. And more anecdotally, I think we said that a lot of people that we've spoken to have said that being by the sea and the sort of more warmer climate of Brighton has meant that more people have come to Brighton as well.
So I'm just going to give you a little bit of a history of HomeEd and what we used to be doing. So so HomeEd used to be a national organisation, and it used to be part of multiple different medical schools. But as students graduated, more and more of them shut down. And as far as we know currently, we're the only ones, only HomeEd left. So when I took over in 2018, we kind of focused on 3 different areas: so volunteering, educational talks, and raising donations. So this is one of the first things that I did. So this was my room in first year. We collected some food we collected over 100 kilograms of food for a local food bank. We were really pleased with this. My flatmates were a little bit less pleased that this is what our flat looked like, but it's just to show you what you can do. We did multiple different, fundraising events, and actually we found that kind of having quite, so for this we did some volleyball. It was a really good way to get people introduced to us, and get to know HomeEd, and then they'd be more likely to come to more of our educational talks as well, like that, as well as raise lots of money. So this particular volleyball raised over £200 for a local charity. And as we got to know more about kind of the local needs in Brighton, we found that a lot of the charities were saying they get lots of donations in winter because a lot of people kind of make that association between it being cold and, and how difficult it must be if you're rough sleeping. But actually summertime is just as difficult for lots of rough sleepers because of the risks of sunburn and dehydration and heat stroke. And so we did a collection of sun cream, water bottles and things like that for local homeless people, which we distributed throughout Brighton. This is, as we kind of got to know charities more, we kind of became more aware that actually we couldn't fundraise large amounts of money. And actually we felt that this money would go further going to smaller charities. And we started working quite closely with Cascade Recovery Centre, which is a local charity that helps provide social support for people recovering from addiction. And so actually this is a picture of some students at one of their English writing workshops, which they run for, anyone to go along to, and it's helping bring back some hobbies that you might have forgotten about. It's a really lovely charity. You can't see this photo, but as people got to know us a bit more and became a bit more aware about homelessness and how, it impacts so many different areas within medicine, we started to be invited to give different talks. And so, I've given talks at the National Paediatric Student Conference about the impact of homelessness on children and young people. And we've also spoken at things like the National Students for Global Health Conference about the dangers of ostracising homeless people from healthcare. And then this is one of the, still something that I'm so proud to be involved in, was our conference in 2020, which was one of the first homeless conferences for medical students. We had over 100 people from across the country come to Brighton to discuss issues surrounding homelessness and inclusion health. So here you can see a photo of one of our speakers from Voices in Exile, which is a refugee charity in Brighton. And then we also had some sort of smaller workshops for people to kind of engage a bit more and kind of learn about something more specifically to do with homelessness. And we had so many different workshops running. So we had some focusing on sort of health needs of traveller communities, to the impact of domestic violence, to, you know, things like drug and alcohol misuse. And it was, you know, really covering quite a broad range of subjects. And we also managed to get some poster competitions going so people could learn about some of the research that's going on into homelessness. And we ended the day with Cascade Recovery Centre Choir, who came and gave us a performance. And it was just a really, really lovely day. However, unfortunately, so that was, you know, it was really good, but unfortunately, we weren't able to run this conference again because of the impact of COVID and how COVID has impacted us as a society. I'm going to hand over now to Anessa, who's going to give you a bit more information. No, I'm not. Sorry, I'm still speaking. So this is just some feedback that we got from the conference. So this gives you an idea that 70% of people before they attended the conference rated their knowledge about homelessness and related factors as being poor. By the end of the conference, you can see just how much more confident people came from even a single day of talks. And everyone would be interested in attending a similar conference, which I think shows just how aware people are of the need to learn about subjects like this. And you can see again that 97% of people who attended felt that medical schools should be including more education around homelessness, and that they didn't feel what they were being provided currently was adequate. And I just wanted to highlight some of the feedback that we got from it. So, you know, that people are very aware that this is a growing problem and that actually we need this knowledge in order to become future doctors. And I mean, I'm talking about doctors specifically, but this is for all healthcare professionals. The fact that people felt it should be included in every medical course. We don't receive enough teaching around these subjects. And lastly, I want to, you know, most people who were there were students. A majority were medical students, but we actually had someone who was a consultant surgeon from the local hospital, and you know, he attended the conference and felt himself that how important it was what we were doing, how important it is to be talking about these subjects as medical students, and that medical students need to be aware of these issues. And I just wanted to highlight this one, that someone said this was one of the best conferences they've ever attended, so I'm quite proud of that. I'm going to hand over now to Anessa.
Hi, yes, sorry. So my laptop's internet stopped working, so I'm on my phone. I apologize. So I'm just going to talk about our current activity. Because of COVID last year, obviously we couldn't do volunteering. We couldn't have those in-person events, so we had to get creative, and Jan will talk more about that. But unfortunately, because of this, not so many people knew about us. So this year we decided to focus more on volunteering, and we have warehouse and street kitchen volunteering every other Saturday, and we work with Sussex Homeless Support. And so far it's been great. We've had some great feedback from the students. They've all enjoyed it. And because we also have volunteering every other Saturday, we just quite often, we had the chance to build a great relationship and connection with the staff of Sussex Homeless Support. So it's really great if you want to do that as well. And another thing we did was collaborate with other societies. And so we had an event for first years, which was linked to our exam. And because of that, many people showed up, and it was great because they found out about our society, and we had a lot of people follow us on social media after. So that's definitely something to keep in mind. And we also have a refugee donation drive with Refugee Sock, which was more for all group years. And yeah, collaborations really help to promote your society and just get more people to join and to attend volunteering later. And in the future, next year, we want to have more educational talks like we did before. So that's something I'm going to work on. And now I'm just going to pass over to Jen, who's going to talk about the lessons we learned along the way.
Yeah, for everyone out there who wants to start a home ed society after our talk, obviously, you can learn from all the mistakes that we've made, which it has been a learning curve. And I think there's been, with COVID, with like understanding keeping a society sustainable, there's been lots of not mistakes, but learning points we've had along the way. If you could go to the next slide, please, Ellie. Thank you. So we kind of split it into 4 main categories. One being learning about managing a society and understanding the importance of delegation and co-production when doing events. So like Ellie was so good at that with the conference, like she taught us a lot of things about how to run it and like how, and learning the skills. So then like the next time, hopefully post-COVID, the next generation can keep that and sustain that sort of them skills. And most importantly, knowing that if it is a student society, and especially healthcare students, your timetable is probably super busy and your capacity can change throughout the year. And so just being aware of like the burnout that people might experience within your society, and just having that reflexive process throughout. And then just voice, so like your voice as a student is powerful, and remembering that. And we've definitely been really lucky with having people like Dr. Sargent and other like lecturers and clinicians who already are working in inclusion health, and so having their backing advocates for a lot of things with the med school. So like younger years are getting a lot more inclusion health than we did back in the day. And so yeah, just remembering that your voice does carry power. And then ethics. So I think having Jeff and Jamesy talk about this as well has been really important, and the importance of learning from people's lived experience and working with organizations and people that aren't paternalistic in the way that they work. So for example, Ellie was talking about the donations before. So like, instead of doing a big donation collection of anything that anyone wants to give, going to organizations, going to people and seeing what is actually needed and what's actually beneficial for people, and then coming back and doing the collection, shows that you're working with people and actually facilitating a need, instead of just thinking about what you think is needed. And so that has been, I think, a big learning experience for all of us. And we've had talks on sort of the ethics and power dynamics that you already have with patients, but then with patients who might be in more insecure housing and situations, just understanding that you need to facilitate a non-judgmental space and reduce that power like dynamic if it exists. And then finally, engagement. Just getting people to engage can be difficult. And so be resilient throughout that. Sometimes you'll have loads of people come to events, sometimes you'll have like 3. So you just have to like keep going and have multiple streams of engagement. So volunteering, fundraising, talks. Yeah, so you can get a whole host of people to engage. Thank you. Oh, and this just a few examples of what we did over COVID, probably our biggest learning curve. And a lot of things we did were online, so we had to be aware of Zoom fatigue. But this was an example of our weekly inequality insights where we gave different multimedia information for people to access in their own time. If you go next, Ellie. And just more sort of social media posts on issues that affect people within the inclusion health population. And then this was our innovative food bank and clothes drive that Holly led on. But it was basically like within COVID rules. So we had to like ask people to put their donations outside. So then we'd go pick it up, and then we'd like leave it for 3 days and then take it to the food bank or Sussex Homeless Support. So a little bit extra, but we adapted to COVID, as did everyone, I guess. that's an example of one of our online talks as well that we had last year. Over to you, Ellie.
I want to say thank you all so much for listening. I hope you found that interesting and gave you some ideas if you are already running your own homeless medicine society, or if you're thinking about setting one up. We're really please message us over social media if you want to ask any questions, or if you want to work with us in future. And thank you all so much for listening. We wanted to end by talking about what we as BSMS students hope that this student faculty could become. And this is, just some ideas that we want to aim for a future where every healthcare professional feels confident that they know how to get the best outcomes for their patients by taking into account their patients' housing and welfare needs. And that we are aiming to do that by creating an accessible and sustainable platform to share knowledge and expertise for all of those involved in healthcare, and to provide the highest quality of care for the insecurely housed population. And that this student faculty is, this is our first ever meeting. This is very new, and we really look forward to having all of your support and all of your guidance in creating this and making this something that can be really, really useful for lots and lots of future medical students. Thank you all so much for listening. I think we're now handing over to John, who's going to talk about Bristol. Is that right? Sorry, John, you're on mute. Can anyone hear John? I'm really sorry.
I can't hear you yet, John. Try now.
Maybe this is something we can save for next time.
Is that okay? Yeah, I think we might have to. Sorry about that. It always happens at the worst possible time, doesn't it? Technical failure. So thank you. That's fantastic. That's really, really good presentation of what you've been doing. And yet, I didn't realise how much you've been doing, which is fantastic. And I think the vision and the mission, I think, are things that we can perhaps adapt and adopt into the student faculty, because I think that puts very succinctly what we're trying to do. So thank you for that. Are there any questions for the BSMS students in terms of what they've been doing in the Home Med Society?
Can I just say something?
Of course.
Yeah,
go ahead.
I put something in the chat, but it's I was really surprised to see how much you were doing, how proactive you were, and just thank you. Because if you're doing it now, hopefully the future will be better for anybody out in the streets. So thank you. I wish you'd been around when I was homeless on the streets. Really appreciate it. Thanks.
Thank you, Jeff.
Thank you, Jeff. That was so nice. We were literally wondering like what you and I don't think James is on the call anymore, but what you both would think about how like we could better our society as well. Like if
it looks really good. I mean, I never really expected that you'd be doing it. I don't know. I suppose I think of medical students running around all day long trying to catch up with everything they've got to do and not really having the time. And then the rest of the time down at the pub, down drinking, partying, enjoying themselves, bottles everywhere. And that's just how you expect students to be. But yeah, it was really nice to see that wasn't the case, and you've done so much. The food bank, particularly, the clothes bank. I know how difficult it is, how hard it can be sometimes when you're in the street and you just can't get anything. Food banks obviously help dramatically now. There weren't many food banks when I was homeless, when I started out as being homeless years ago, but it helps a lot. But it's only good if people like yourselves are actually finding the food and put in the food bank. It doesn't just miraculously you turn up there every morning, you know. It's not a wave of a magic wand and suddenly there's a lot of food there. So brilliant, thank you. I really appreciate it. I suppose for all the people that I work with, because I work with a lot of people who are street homeless still, and I think it's a big hope for the future that you're doing such as what you are. So well done, thank you.
Thanks, Jeff. Any other questions or points? Anybody? I was going to ask, if somebody is in another place is thinking of setting up a society, what would be the sort of first things that they would need to do? What would be your advice?
I'm happy to have a go at answering this. So it does depend quite a lot on how your med school works. So for us at BSMS, you go through MedSoc to set up a society, and it's quite med school dependent. But in terms of the more general advice that we can give, having people like Chris, who are incredibly knowledgeable in these areas, to speak to was really, really beneficial, because it kind of gave us, Chris can tell us who to contact when we want to talk about certain things, and can kind of guide us in what we're doing, which was really useful. But I think one of the things that we found is that we just keep messaging people over Facebook, and we'll find a charity that we like, and we'll contact them, and we'll contact as many people as we can. And, we might not get responses to 9 out of 10 emails, but the 1 in 10, you get a good response, and you can work with them, and you can pick their brains, and you can get them in at future events. And I think it's, so I think that's kind of a big thing, is just putting yourself out there and introducing yourself to everybody. And I would be in lectures, and if I had a lecturer come in who I thought had said something relevant, then I'd go up at the end and I'd be like, hello, give me your email address, because you're going to come and speak at a home ed event for me. Thank you very much. And stuff like that. But it's also, I think, like Jan said earlier, about the fact that you might not get a lot of people turning up sometimes, and sometimes it feels really demoralizing when you've put in loads of work and you turn down some pub visits to set something up, and people don't turn up. But actually, you just got to keep going. And I think I'm very proud of what we've all managed together.
Yeah, you have done fantastically. So it sounds like it's a good idea to find the sort of clinical people in the area who might be interested, because most areas have some services for people who are homeless. And if you can find a person who's sort of working in that field, that they might be supportive. I guess it's probably also important to get a group of people together, to sort of find the people who are also interested in the same things, and then, as you say, get started and see where you can go to.
Yeah, and if anyone wants to contact us, just message us over Facebook or Instagram. I'll put our social media handle into the chat. Please message us, and we're very happy to help. We, through this and through Chris, know lots of different organisations throughout the UK, so we can help in some way.
Great. Jan, were you going to say something?
I was literally going to say exactly the same, Ali. Exactly the same thing.
All right. Okay. Fantastic. Thank you ever so much. That's been really sort of inspirational in terms of what people can achieve. And as you say, probably the most important thing is to make a start, and then then you can take it to wherever you want it to go. So that's brilliant. Thank you. Okay, we're out of time, and a couple of people have already left because obviously you've got things to do. So thank you ever so much to all our speakers. I think Jeff's still here, so thank you to Jeff, and thank you to Ellie, Janani, Nessa. Two really, really good and quite contrasting presentations. But I think that's what we can try and do, is have a range of things that people can talk about, just to sort of give people ideas and inspiration and get people thinking. So thank you. I think it's been a really good first meeting. I think we agreed that our next meeting will be on the 18th of July, which is a Monday, and we'll send out communications about that. And for the people on the committee, we'll have a committee meeting before then. But I'll need to check my diary about what we said when we said that's going to be. So thank you again to our speakers. Hope you all have a nice rest of the evening, and we'll meet again very soon. Thank you very much.
Thank you. Bye.
Bye everyone. Thank you.